Hello, everyone. Good afternoon. I am María Jesús Pascau, the TransplantChild Nurses Coordinator. I'm going to talk about the survey we sent you a few months ago concerning the social resources that families with transplant children have at their hands in your centers. The design of a European map of social resources was one of the main objectives of the healthcare work group for this year, 2020. Well, the first question about this subject is why? Why to work about social resources? It's important not to forget that one of the aims of TransplantChild is to improve the quality of life of transplant children and their families. One of the main concerns of families when they discover that the transplant means to face a chronic situation is how to deal with the associated expenses. Another problem is how to adapt the family logistics to the hospital admissions, medical appointments, or how to restore family life after the transplant. Faced with these problems, families need to know what are the resources available. Ignoring the problem is not the solution. Knowing the situation and demanding solutions is the core responsibility of families and the health system. This project intends to help us to identify the problems and, if it's possible, to help to solve it. Well, last summer we sent you a survey about the social resources for families of transplant children and in your hospitals. Here you can see the different objectives we were looking for. We aim to identify the social resources available to families, not only economic aids, but also social services or benefits as grants, access to medicines, hospitalization services, a school at hospital, etc. At the same time, we want to know who the provider of the aid is in each case. Is the public system? Are patients' associations? Or are private initiatives? Another question, how difficult is the access to each of these resources? And finally, with all the information obtained, we would like to draw up a European map of the social resources for transplant children and their families. From the very beginning, we decided that a multidisciplinary approach was necessary if we wanted to reflect reality. These are people involved in this survey design: TransplantChild Technical Secretariat, social workers, patient associations, families, nurses, psychologists, and physicians. 3 of the partners of the survey development were also the target audience of our study. On the one hand, the social workers of transplant child's hospitals. On the other hand, the families of the transplant children, who are the ones who claim these benefits. As is often the case, the most significant difficulty was reaching these groups. We didn't have direct contact with the social workers of the different centers, so we sent the survey to the representatives of each location and asked them to look for the right people in his or her hospital to take the survey. To reach families, we had to do something similar, to rely on the patients' associations to contact families. Since we found discrepancies between the responses of the social workers and the families, we decided first to analyze the answers of the social workers in each center. We believe they have a complete picture of existing resources. Today, we present the results of this first analysis, but we are aware that a second analysis with the families' responses is still needed. As we can see here, we identified 6 different areas of interest related to social resources. These areas were long-term financial assistance, financial aid during hospitalization, support during hospitalization, educational support, drugs, pharmaceuticals, and medical devices, and others. Each of these sections includes a variable number of primary questions about facilities and secondary questions about accessibility or who is the provider of the aid. We have received 27 answers from 15 different hospitals. 11 of these centers were full members and 4 of them associated members. At this point, I want to thank the participating centers for their collaboration, especially the 4 associated hospitals. The survey was long, and it wasn't easy to find the right person to answer the survey. We are aware of the difficulties that some of the representatives had in locating social workers and obtaining their answers. So thank you again. Regarding the analysis of the answers, we will send you soon an exhaustive report with all the results obtained. But in the next slides, I will present just some of these results. To show you all of them would be too long. First section of the survey asked about long-term financial assistance. There were questions about 7 different items. You can see here the answers to the first question. Is there any financial assistance for the care of a transplanted child? In the first column, those centers that responded affirmatively are marked in green, and those that responded no are in gray. As you can see in the second graphic, the survey asked for additional information about the types of support. Options were service-related payments, monthly remuneration, or others. We also asked families to specify the approximate amount of the aid, who gave them the information on these aids, and finally, we asked them about the time that passed between the application and the receipt of the help. As you can see from the last graph, most families received their payment in the first 3 months after applying. But the number of families who take more than 1 year to receive the aid is significant. In the section about services, the survey asked, among other things, many different questions about services available for the primary caregiver to know the comfort that families have during hospital admissions. As you can see in this slide, educational support during hospitalization is available in 87% of the cases, but only 40% of hospitals have a school awareness program. In the right side, you can also see the differences in the length of schooling services at home, from 1 month to 2 years. We also asked several questions about drugs, pharmaceuticals, and medical devices. Here you can see some of these results checking not only if the aid exists, but also the accessibility of the families to each of these resources. We have done also an aggregated analysis of the resource by country. These maps show the amount of 13 resources existing per center. There is a map for each section of the survey and one that collects the global results. The size of the spheres shows the number of resources. The differences are more evident in the section analysis than in the overall analysis. It is important to complete the information given in the previous slides by pointing out that there are resources available in almost all hospitals, while others are a minority. Some aids exist in all the hospitals, but others just in 3 or 6 of them. Our results have some limitations. as they can see, participation has been acceptable, but could be better. The answers to some questions suggest that we have to ask for additional information to be sure of what it means. And families' responses may be conditioned by the age of the transplant and each family's particular needs. It's possible that 10 years ago didn't exist some services or aids that today are usual. As conclusions or provisional conclusions, the more complete the answers we get, the more complete will be the map of social resources we will be able to make, and the more it will approach the reality we want to know. We have also to discuss and agree a proposal about those resources that must be at disposal of any family with a transplant child. And the analysis of those data obtained from families must be completed. Well, we have a new opportunity to complete the results. Those hospitals that have answered the survey can review their data to complete the information. And those hospitals that have not previously participated can do it now. Do our results match up with patients' perception? There are discrepancies between the responses of social workers and those of families. Are these discrepancies caused because families don't have a complete information about the resources they have at their disposal? We think these discrepancies are an opportunity for local studies open to internal discussion on the quality and effectiveness of communication between the healthcare team and families. And finally, we have the opportunity to produce a position paper on the minimal social resources that should be available to any transplant child and family in the European Union. Thank you very much, and here you have my email address to share with those nurses you think might be interested in collaborating with the network. Thank you very much.